Hi, welcome. My name is Jess Nesbitt. Today we're going to be talking about what I call Brain Injury 101, which is a lot of helpful information about brain injury. So let me tell you about the Brain Injury Association first a little bit. So we are a nonprofit that serves the whole state of Maryland, although we are located outside of Baltimore City. And we've been around since 1983. And we were started by family members of people with brain injuries who couldn't really find the services and supports that they needed. And so that legacy certainly continues today. We try to provide support and resources and coordination to family members and individuals with brain injuries who need some support. We also do a lot of other projects. I'm the health educator, as well as a case manager. So I provide education. We help with research and outreach and have a lot of other fun projects going on. But we also provide case management for the Traumatic Brain Injury Waiver Program, which is a small Medicaid waiver for people with injuries. So that's us, and that's me and my role. I do use she and her pronouns. A couple of things before we get started. We'll talk a little bit about housekeeping, but I wanted to welcome you. Thank you for spending some time learning, alongside me today. We'll then have a little bit of an opener, a little questions and answer, and then we'll talk about brain injury in general. I want to spend a little time talking about some special populations because certain people or certain groups of people are more likely to have brain injuries, so we'll get to that. We'll talk about mental health and substance use. Those are pretty important things to cover when it comes to brain injury. And then I'll briefly touch on a couple of support skills and just some best practices for supporting people. And I'll touch on a couple of resources that are available in Maryland. So as I'm recording this, I'm working from home. We are all dealing with the effects of COVID-19, which are, some of those are, our jobs are changing, we're losing jobs, but I think also there's a lot of mental health effects. And so I want to recognize that and also see if we can incorporate taking care of ourselves into this webinar. So before you get started with everything, just take a minute. Are you comfortable? Do you need something to drink? Do you have something to write with? Are you in a good space to take in information? Sometimes we're just not quite in the headspace to learn, and that's okay. But I'd encourage you to learn what you can or come back maybe when it's a better time. And just so you know, I will have a couple of summary questions at the end of each section. And so that's a good point to take a break if you need to stretch or have, water or snack or whatever. So for questions and answers, if we were in a room together, I would ask you these questions and make you guess them out loud. I'm still going to ask you them. And so feel free to, say out loud what you're thinking or just in your head to yourself. Okay, so you'll see how it works once we get started. So the first question is, how much does the adult brain weigh? Is it 1.5 pounds, 3 pounds, or 5 pounds? And I'll give you a second to think about that. And it is 3 pounds. And it reaches that weight by the time we're 12 years old, which is pretty surprising. We're not asked to do a lot of the adult skills that we do now when we're 12. So the second question is that this is a statement rather, men are twice as likely to sustain a brain injury as women. Is that true or is that false? So saying that men are more likely to have traumatic brain injuries. And that is true. And we will get into why that is in a little bit, even if you have some ideas. The next question is, which of the following is an example of a compensatory strategy? A day planner, is that a compensatory strategy? Alarms on cell phones for different tasks or reminders, or step-by-step instructions? So which of those is a compensatory strategy? And the answer is that all of them are. And if you're not sure what a compensatory strategy is, that's okay. What that means is it is a strategy or an environmental modification that helps sort of bypass maybe any changes or impairments after a brain injury. So if I'm somebody that struggles to remember what meetings I have from day to day, maybe a day planner is a really good way to remind me of those things and to help me keep track. So rather than trying to do all that internally, there's some environmental modifications or changes that people can make and use to help support them on a daily basis. And then the next question, this is a big one. So how many people do you think are treated in the US in emergency departments, hospitalized, or die as a result of a traumatic brain injury each year? The first question, or the first answer is 231,840. The next is 2.8 million. And the last is 1.2 million. So what this question is getting at is how many people do you think are affected, that we can capture in the medical system by TBI each year? And the answer is 2.8 million. And I'll explain that in a moment because that does contain a lot of different elements. But what I want you to know too is that the other two numbers, 231,840, that's the number of people that are diagnosed with invasive breast cancer each year. And 1.2 million, that's the amount of people living with HIV or AIDS in a given year. And so I don't bring those up to draw a distinction or say that one is more important than another, but just to show you how big of an effect brain injury has each year. And those are the people that we can capture, that we can see in emergency departments or in the hospital, but plenty of people don't go or seek care or don't know that they've had an injury, and so we don't really know that number. But let me break it down for you a little bit, because like I said, that question has a lot of elements. So of the 2.8 million traumatic brain injuries each year, about 56,000 people do die. And 282,000 people are hospitalized. And then about 2.5 million people are treated and released from the ER. So that means that's good. Most people are doing okay and surviving. But that is a lot of people. Like I said, that number doesn't capture everybody necessarily. And in the infographic that I have on this slide towards the bottom, there's a note that says about up to 15% of people diagnosed with a mild TBI might have long-term problems. So a lot of people are doing okay and bouncing back. And so when we get to some of the changes that might happen after a brain injury, we're going to be talking mostly about that 15% of people that are still struggling. And so then, which of these celebrities has not had a TBI? So another way of saying this is that 3 people that we know of have had a TBI, and 1 person has not. So Tracy Morgan, has he had a TBI? Has Ben Roethlisberger, has Anne Hathaway, and has George Clooney. So I usually go down the line, right? I say, okay, has Tracy Morgan had a TBI? And a lot of people know that he had a pretty bad accident. He was hit by a tractor trailer in a parking lot, and he was actually in a coma for 8 days, which is what we consider a severe TBI. And then I go to Ben Roethlisberger, and people are like, oh yeah, of course, we knew. Yes, he plays football, which is interesting, right? Because now people are really aware that football players, hockey players are sustaining multiple traumatic brain injuries. And the thing to know about those multiple injuries is that they do have cumulative effects, meaning that if you have a lot of injuries, that will have the same effect as a more moderate or even severe injury. Anne Hathaway, I don't know, has she? And has George Clooney? So Anne Hathaway, as far as we know, has not had an injury, but where I usually trick people is with George Clooney. And people say, no, he looks good. He's fine. You know, he always is. having adventures and making new movies or what have you. But he was filming a movie, and he was filming a fight scene. And his chair fell back, he hit the ground, and he started having all sorts of changes. He started really struggling with depression and his memory. He was, I think, then went on to direct another film, and he had to put Post-it notes all over his space to remember his lines and to keep functioning. So that's that compensatory strategy that we just talked about, right? Trying to keep yourself on track with some external cues. And he actually was leaking cerebral spinal fluid from his nose. And his depression got so severe that and his pain too became so severe that he was thinking of hurting himself. And he was able to see a doctor, and I think he had surgery and is doing much better now. But I like to bring him up because people will say he looks good, he's really successful. And that's true, but we just don't know. You can never know if somebody's had a brain injury or not. Because you can't see, right? Inside somebody's brain. So that will probably be a theme, is that we just don't know who does and doesn't have an injury. And so I would encourage you to walk around like everybody does in some ways, of trying to support people and understand why people might be acting certain ways. You know, I think we can do a lot to accommodate people. So that is the end of questions and answers. Let's talk about brain injury in general a little bit. So what is a traumatic or acquired brain injury? You'll hear me say TBI a lot through this conversation, and that stands for traumatic brain injury. A less commonly used word, at least in the United States, is ABI, which is for acquired brain injury. So what's the difference? So TBI, traumatic brain injury, trauma is in there. That is defined by an insult to the brain that's caused by something external, typically, and it's a physical force. So there's something outside of you that is causing an injury to your head. So examples of that are varied, and we'll talk about those, but it could be a fall, a car crash, sport injuries, assaults. An acquired brain injury is defined as an insult to the brain that occurs after birth, usually caused by some internal factors. So this could be something like a stroke, an aneurysm, a lack of oxygen to the brain, which is hypoxia or anoxia. And we're seeing these more with opioid overdoses, where people are losing oxygen to their brain when they overdose, and then are coming back with a traumatic brain, or an acquired brain injury, I'm sorry. But it could also be caused by a tumor, and a traumatic brain injury is also an acquired brain injury. So another way of looking at that might be that acquired brain injury is the umbrella term, and then everything else can fall under it. So a stroke might be there, a tumor, and a TBI is an acquired brain injury. Okay. So how does injury happen? This is a simplified video, but I will press play and we'll watch that again. So you have your brain. It's very soft. This can be a little gross to some people, but it's the consistency of like cooked cauliflower or Jell-O. And our skulls are meant to protect us. So they are really hard, and they're good, you know, they're effective. But when your really soft brain meets your really hard skull, that will cause damage. So I'll show you what that looks like. Basically, your brain is jostling around. When I was showing this, you know, in another presentation, someone said, so that's all it takes, like just a little hit to have your brain jostle that much. And the thing that this video doesn't show is that you do have cerebral spinal fluid that's protecting your brain from jostling so much. But that can show you, you know, what it looks like to some degree when your brain is hit. And the other thing that this shows is that if you, say, get hit from behind in a car crash, for example, you are thrust forward, right, from the force. So your soft brain is going to hit the front of your skull. And then it's also, because of the force, you're going to be pushed backward, and you're also probably going to hit the back of your skull as well. So that is what's called coup contre coup. It's that back and forth that causes injury to multiple parts of your brain. So that's one way to think about how an injury happens. We're also going to watch a quick video that talks a little bit more about what's happening at a level of neurons and what's going on there. So I'm not the science person, so I'm going to let somebody from TED explain it, and then we'll check in after that.
Each year in the United States, players of sports and recreational activities receive between 2.5 and 4 million concussions. How dangerous are all those concussions? The answer is complicated and lies in who strikes it. The brain is made of soft, fatty tissue with a consistency something like Jell-O. Inside its protective membranes and the skull's hard casing, this delicate organ is usually well shielded. But a sudden jolt can make the brain shift and bump against the skull's hard interior. And unlike Jell-O, the brain's tissue isn't uniform. It's made of a vast network of 90 billion neurons, which relay signals through their long axons to communicate throughout the brain and control our bodies. This spindly structure makes them very fragile, so that when impacted, neurons will stretch and even tear. That not only disrupts their ability to communicate, but as destroyed axons begin to degenerate, they also release toxins, causing the death of other neurons too. This combination of events causes a concussion. The damage can manifest in many different ways.
Okay, so I like that video because it breaks things down, at least for me, and helps me understand that, yes, there is actually what's happening to your brain when it hits something or when there's bruising or bleeding, but then there's also more happening at a neuronal level, which is where your axons are tearing and shearing. So that's just another way of explaining what's happening too. Close out of that. All right, so moving on to some common causes of non-fatal TBI. So what is causing people to get brain injuries? And surprising to me, at least when I first started in this field, was that most injuries are caused by falls. So 47% of non-fatal traumatic brain injuries are from falls. After that, you have the category of struck by or against. So that could be you could be struck by an object, you could be struck by a person, you could be struck by, I think the example I think of is sports, when you're hitting another person or the helmet, what have you. After that, there's traffic incidences, so car crashes, motorcycle accidents. And that was actually kind of what I had thought was the leading cause before I started this role, just because you see it everywhere. You don't always see people falling, if that makes sense. Assault is the next leading cause of injury. Unknown is the next at about 8%. And what that means is that, you know, it sounds self-explanatory, but we don't know what happened. And so the way that could look is somebody could be down on the ground, somebody else calls an ambulance, they get them to the hospital, and they can see that there's been a brain bleed or something that has damaged the brain. So we don't know exactly what transpired to give that person an injury, but we know there's an injury. And then the other category is just anything else that you could think of that could happen. And just to be clear, this is for traumatic brain injuries. If we're looking at acquired brain injuries, there's a whole host of other, common causes. I believe the primary cause is stroke, but there's brain surgery, tumors, heart attacks causing a lack of oxygen to the brain. One thing that I was just reading about was lead poisoning causing brain damage. So there is a differentiation between, traumatic brain injury and acquired brain injury here. So I'm not going to go into this too intensely, but I did just want to touch briefly on levels of severity, because just like any kind of injury, whether you break your ankle or sprain it, there are different severity levels. So for most people that have traumatic brain injuries, they have a mild injury. That's also called a concussion. And how is that defined? Along the right-hand side, there's some ways to measure if a TBI is severe or mild or moderate. And so doctors might look at loss of consciousness for less than 30 minutes. But one thing to know too is that you don't have to have a loss of consciousness to sustain a brain injury. You might have what's called an alteration in consciousness, which is when you might feel dizzy or out of it or be like seeing stars. That can also be a brain injury. It can be a concussion. People fall into the mild category when they have something called post-traumatic amnesia for less than an hour. And that is the time after the injury or accident where the lights are on, but nobody's home, is what Stacia Edmonston says. You might be able to have a conversation with someone, they're chatting with you, they're able to tell you some basic information, but they're not laying down any new information. So oftentimes they've forgotten what's happened in the time frame between their injury and then maybe an hour or 2 hours or several hours later. So there's that amnesia effect that happens after an injury because your brain's trying to protect itself. And then there's also the Glasgow Coma Scale, which I won't get into, but it's also called GSC, and you see that sometimes on medical records. So about 80% of TBIs are mild, and then about 10 to 13% are more moderate. And so now you'll see that people are losing consciousness for 30 minutes up to a day. They're having that amnesia period for an hour up to a day. And their Glasgow Coma Scale rating will change. And then severe injury is when somebody has lost consciousness for 24 hours or more. And that's usually what we would call a coma. Or they're having post-traumatic amnesia for more than 24 hours as well. So some groups are more likely to sustain TBIs than others. There are some different risk factors. So, pardon me. All right, so back to risk factors. Like I was saying, even with the beginning of the presentation, talking about men being more likely to sustain injuries, there are some groups of people that are more likely than others to have injuries. Age is one of those risk factors. So we know that falls are the leading cause of TBI. And who comes to mind when you think of people that fall often? That's often older adults and also young children. Adolescents too have a higher rate of injuries because of car crashes, and then intentional injuries. So that's something like a fight or a suicide attempt, something like that. In terms of another risk factor is socioeconomic status. So if you have studied or know about social determinants of health, or have read, any study about health outcomes of people who are lower income, you'll know that people in a lower income have worse outcomes when it comes to health, and TBI is included in that. But it's also because, maybe there's less access to preventative measures like baby gates. Maybe there's a lack of a safe place to stay or play, I'm sorry. Or like we were talking about lead poisoning, that usually is happening in poorer communities of color, which we could spend a lot more time talking about. But we know that that does mean that poorer people have higher incident rates of TBI. And gender. Okay, why do men have higher rates of TBI? I'll let you guess. But there's a couple of reasons. So one is that men do have riskier behaviors or might be more risk-taking than women. Another reason is that some types of labor that men do are more likely to cause injuries. So construction or roofing or things like that. And then also men tend to be mostly, I would say, making up those sports. I'm sorry, they're people playing the high contact sports. And so you're seeing more injuries because of that. So then there are some other more behavioral type risk factors that might make people more likely to sustain traumatic brain injuries. And we'll spend some more time talking about this later, but people who misuse drugs or alcohol might have higher rates of TBI. And if you think about why, at least with alcohol, that decreases your inhibition, some of your executive functioning skills. And so people tend to injure themselves. Or maybe somebody's drinking and driving and gets in a car crash, things like that. Some people who are violence prone or who get in a lot of fights, or you're in a close proximity to people that are fighting a lot, might have a TBI. This includes children who are subject to childhood abuse, right? So shaken baby syndrome is a traumatic brain injury. And then one thing I want to touch on as well is that if you have had a traumatic brain injury before, you are at a higher rate of having another one. So as we move to this next slide, I'll show you what I mean. So say you have your first injury. After the first one, you're actually 3 times more likely to sustain another injury. Okay, that gets you to your second. And then after your second injury, you're 8 times more likely to have a third injury. And the reasons for that vary. Say your first injury, you affected the way that you walk or your balance, you might be more prone to falling and having another injury. Or if your injury has sort of changed some of your impulse control, maybe you're getting into fights with more frequency, that sort of thing. And then there are some groups of people that we know have those multiple mild traumatic brain injuries, like I was talking about with Ben Roethlisberger, right? So athletes are getting a lot of concussions, multiple injuries. But there's some other groups, and I would, ask you to see if there are any of these groups that surprise you. Folks who are homeless have higher rates of TBI and multiple TBIs. People with mental illnesses, people who use drugs, people who are incarcerated, and then victims of domestic violence or childhood abuse. So we'll talk about each of those, I believe, in a little more detail moving forward. But let's check in. So now's a good time to take a break, stretch, move around, go to the bathroom. Feel free to pause me here. I'm going to have some water. And I'll do a little quiz. So what is the most common cause of brain injury? Is it A, car crashes, B, assaults, or C, falls? And it is falls. And then your next review question is, after the first traumatic brain injury, a person is X times more likely to sustain a second TBI. Are they twice as likely, 3 times as likely, or 5 times as likely? and they are going to be 3 times as likely to sustain a second traumatic brain injury. After that, they're going to be 8 times more likely. I already said this, but now's a good time to take a quick break if you like. All right, so we're going to move on to anatomy. To be very frank with you, we're not going to spend a ton of time on this because really I think when it comes to brain injury, finding ways to support people, to me at least, is the important part. And sometimes we get hung up on what the brain is doing and we feel like we don't know enough about the brain to support somebody. I'm just going to give you the highlights and then we're going to talk about, you know, the information you actually need to take care of somebody or support somebody appropriately. And one thing that I just want to stress, you know, I say it all the time, but I am just, every now and then I realize the gravity of it, but your brain is vital. Our brain controls so much of what we do and who we are, and it helps us get by on a day-to-day basis. So when you have an injury to your brain, that can be, for some people, life-changing. It might not be too disruptive, but your brain is a big deal and it's responsible for a lot of things. And what I want to spend the most time on probably is your frontal lobe. So that is going to be at the front of your brain. It is most vulnerable to injury along with the temporal lobe along the side here. And for the frontal lobe, that's because it's big. It takes up a lot of real estate. And it's responsible for a lot of really important things too. So it's responsible for our higher cognitive functioning. And that includes executive functioning, but I'll ask you to put a brief pin in that because we're going to spend a little more time talking about that. But includes things like reasoning and judgment. It's responsible for, at least in some ways, how we behave. It helps us problem solve or maybe not problem solve. It plays a role with our emotions, our ability to speak, and, you know, voluntary motor activity. So our ability to move our hands or our feet in however we ask our brain to make them move. And so what is executive functioning? So technically, according to Merriam-Webster, it's a group of complex mental processes and cognitive abilities. So for example, reasoning or impulse control that control skills like organizing or managing time that are required for goal-directed behavior. So your executive functioning is all those skills, all those things that some of us don't even think about very much that allow us to get by on a day-to-day basis and hold down a job and keep track of, you know, the million things going on in all our lives. And so if you have an injury to your frontal lobe, chances are I would say you're going to have some trouble with executive functioning after an injury. And so another way to think about executive functioning is that it can be described as like air traffic control. So air traffic, right, at a busy airport manages departures. You have departures going on all at once. You have arrivals on multiple runways, and you have to prioritize, you have to problem solve, you have to find out what goes where. I don't know if you can tell, I don't know much about what air traffic control does, but our brain also needs skills like that to filter out distractions, prioritize certain tasks, set and achieve goals, and then control our impulses. So if you think about it, or if you start to learn more about executive functioning, it really does a lot for us. And so we'll talk about this more, but it can be such a challenge after an injury if you have changes to your executive functioning. And that might be a good time for you to use some compensatory strategies, potentially. One thing I didn't touch on yet, which I'm sure I will, is that every brain injury is very, very, very different. So just like our two brains, I'm speaking to you, I don't know who you are, but our brains, right, are very different. They make us different. They make us have a different personality and what have you. Every brain injury is then going to be different too. So what might work for one person, definitely not going to work for another person. So if you're working with people with brain injuries, it requires flexibility, if you are somebody with a brain injury, you probably already know you have to be flexible and persistent and creative. And so I just think that's something to keep in mind as we go forward. I might generalize some things and say, this is common with brain injury, but it's going to depend person to person. All right, so your frontal lobe is a big deal. And your temporal lobe is also the other lobe that is most affected by brain injury. Your temporal bone is the thinnest in the skull, which makes it more vulnerable to injury. And this lobe plays a role in your emotions, in your memory, hearing, understanding language, and then organizing and sequencing information. Your parietal lobe, that's going to be towards the back upper part of your head. That plays a role in spatial perception, visual perception, and something called proprioception, which is where you are in space and time and in relation to other objects. Okay, there's your, $2 word for the day. The parietal lobe also helps us differentiate size and shape and color. And it also contains Wernicke's area, which is responsible for the comprehension of speech. Then you have your trusty occipital lobe that is going to be at the back of your brain. And that's mainly responsible for vision and recognition. But as we talked about with that coup contra coup, so that's that forward motion, for example, and then the backward motion. What that might mean is that you might hit your frontal lobe, have injuries there, and then you might also be thrust back and hit your occipital lobe and then have vision problems. So just because an injury is at one part of your brain doesn't mean it's not affecting other lobes. This is a big simplification of how your brain works, but I think the important takeaways here are executive functioning, and also the complexity of the brain and how much it really is responsible for that I at least, I know I probably take for granted. And then you have your brainstem too, which is responsible for breathing and body temperature, digestion, alertness, and swallowing. So what effect can a brain injury have on someone? What causes brain injuries? Who's more likely to have some brain injuries? What the parts of the brain are responsible for, but what does it mean on a day-to-day basis? So before we get into this, because I'm going to list some different changes that might happen, and I just want to be really conscious to not talk of them as problems. A person with a brain injury can say, yes, this is a problem to me, but I want to show you this video to sort of frame and sort of think a little bit more critically about how we talk about changes after brain injury. So let me pull that up. And it's also just very honest, and I think a really, at least in my experience, a pretty fair description of what a brain injury might feel like.
So I'm going to talk a bit about the journey of brain injury. Everyone's ABI is different, and so that means that everyone's journey is going to be really unique. But I think there are some commonalities. Firstly, brain injuries do improve. They do get better. They never go away, but with the passage of time, they do get better. And it makes me smile to think about all the people I know in my life who don't have brain injuries, and as they get older, their brains are declining, but ours are actually improving. There's also lots of milestones with brain injury. So a brain injury at 2 years is going to look really different at 7 years, and then again at 10 years, and then also at 20 years, which is where I'm at today. For the first few years of your brain injury, it can feel like nothing much is improving, or at least not enough, and it might feel like your life will never be worth living again. I certainly felt that. I went from crisis to crisis with all this emotional instability and lack of memory and fatigue, and I just kept getting myself into trouble constantly. And it was so exhausting. But around about 7 years, things started to change, and I started to have more good things happen in my life than bad things. And since then, that's improved. So a common feature of all brain injuries is the massive challenge to your sense of identity. So much of how you define yourself is going to change in an instant. Sometimes I've called this the great brain injury identity theft. I reckon that this is the biggest existential crisis you'll ever have to face in your life. And most other people will never have to face such a big challenge as this, or have to find the courage and the strength to survive this. So the next time somebody dismisses you, remember this, because you have been to places that few people will ever visit. Almost everyone with a brain injury will tell you about the early years of isolation and confusion. It's not uncommon for about 90% of your friends to disappear. So you're going to have to get used to spending time with yourself. And it might take time to find out that you're not the only one with a brain injury. And it might take even more time to find the community of people with brain injury out there. But when you do find them, it's going to be amazing, but it's also going to be confusing. This journey of brain injury is also going to turn you into some of the most interesting people around. But rather sadly, this is still a bit of a secret. But you are going to develop a whole lot of creativity. You're going to have to, so that you can deal with the challenges of your unique brain injury. And a final thing about this brain injury journey is that it's going to take some time, and you will for sure learn some patience. Everything slows down for us, and things can take just so long to do. And since so much of yourself will have changed, it's also going to take time to get to know this new person. And it's going to take time not just to understand what brain injury is, but also to accept that this has happened to you. And then when you find this acceptance, it comes and it goes. And it can take many, many years before you really embrace and understand and become proud of this new person with your brain injury. You might not be there yet. I'm not 100% completely there yet, but I do believe and I do know that it will happen and we will get there. I promise you. It might feel like 2 steps forward and 1 step back, but ultimately you are heading forward.
So I absolutely love that video. I think for those of us who don't have injuries, it helps us come from a place of compassion and understanding how difficult this can be. But it's also not framing things just in terms of problems or things that need to be fixed necessarily, right? She's talking about, yeah, there's all these things that you're going to learn too along the way, creativity and resiliency. So with that in mind, I just want to now talk about some changes we might see, but know that that's not the whole picture, right? There's a lot going on for people. So what are some physical changes? I'll do physical and cognitive and emotional changes. I would say probably the most common one I hear is fatigue. Now, I've listed it under physical changes, and it can be physical fatigue, absolutely. I think especially earlier on in your journey. But that is also very much cognitive fatigue and mental fatigue. If you have an injury to your brain, it means it's probably working slower than it did before. And so you're having to work extra hard to keep up with meetings or tracking conversations. And that really will tire people out. You know, it's not uncommon for people to need, you know, after a big meeting or something that's cognitively challenging, just some time to really take it easy and kind of take that time to heal, I guess. Headaches are also common. Dizziness might happen. A lot of people do have trouble with sleep as well. And because your brain controls a lot of your senses, you might have a change or a loss in hearing. And similarly, your brain, it helps us talk and communicate. And so you could have your speech being slowed or slurred. And that is can be a real challenge, if you're trying to make phone calls, people don't really know you potentially. And, it's not, I've heard of at least one story where people were like, oh, they just thought I was drunk and I didn't get the answer to my question. So we have to be kind and not assume things about people, right? It could just be an injury. Particularly with stroke, you might see spasticity or like a muscle contraction where somebody's muscles can't relax. People might have some tremors. Having a traumatic brain injury does lower your seizure threshold, meaning you're more likely to have seizures. So you might see people, if you're working in like a hospital or some sort of medical setting, people with a lot of seizure medication. There might be changes to your motor skills or your balance, depending on, your unique injury. Folks might have trouble with coordination, hand-eye coordination, maybe like more fine motor skill types of coordination. Listed fatigue again, but weaknesses can also happen. You might have a change or a taste in smell. I know at least of one or two people where for whatever reason after their injury, they can't smell. And some people do have bladder and bowel difficulties. And so this doesn't encompass everything, but this might be some changes that people are going through after an injury. So cognitive changes, what could happen potentially? People might have trouble with their short-term memory. It could be long-term. I typically see more short-term. Folks might have trouble paying attention or concentrating. Like I was saying, if you are having to work a lot harder to do the things that you used to do, it might be tiring to pay attention and to really be focusing. And so it might seem like concentration is waning or waxing. People might have trouble processing information, perhaps like as quickly as they did before. And the tricky part about a brain injury is you can't see the changes to someone's brain. So somebody looks the same, and now all of a sudden maybe the conversation is taking longer, or they seem confused, and that can be hard for people. But that's why, I try to educate, and we're all trying to educate, just teach people, what is going on for somebody. So the way that might look if you're supporting somebody is just asking one question, being okay with silence and giving somebody some time to think it through and answer. We talked about those executive functioning skills potentially being changed. Problem solving might be hard. Your brain does a lot of that seemingly without being asked sometimes. Something can happen that's called confabulation. Another word for that, or another way people describe that, is like honest lying, where maybe somebody doesn't remember what they did that morning, but rather than say that, they might kind of fill in the blanks. And so it might seem like somebody's lying, but it's not malicious or deceitful. It's usually just somebody kind of filling in the blanks. A lot of people struggle with a lack of self-awareness, and we'll talk about that in a couple of slides. Organization and planning might be affected, might be trickier. Some people have aphasia, which is a communication disorder. And there's two types. There's expressive aphasia, where you have trouble getting your words out or being understood. And then there's receptive aphasia, where you have trouble understanding what people are saying to you. And understandably, that can make it really hard to have a conversation. And we'll talk about how you can support people dealing with that. Some people will perseverate. And what that means is people kind of stick to one topic or idea or thought. Or it could be a physical thing where somebody has to come and, Stacia tells a story of somebody who had to pick the pills off of her sweater. It was just like, that's where your focus goes. Judgment might be affected, and you might have more trouble controlling impulses, right? If the part of your brain that managed that before has been changed in any way, that might be different. So then there's some behavioral changes that I think the individual in the video talked about, some of those, right? So there's grief around the injury. Things are different, potentially, and that's hard. As she said, there's maybe questions around identity. Who am I? You know, some people describe personality changes after a brain injury, and that has to be really difficult to deal with. We also know people have mood swings or depression or anxiety. And some of that can be around, right, like the grief around your injury or your identity, but it also might be just the physical changes to your brain after a TBI. Some people have trouble controlling their emotions. There's something called pseudo-bulbar effect, where people will maybe laugh or cry, maybe at inappropriate times, it seems, or they can't really control those stronger emotions. And that is certainly something that can happen after an injury. Some people have trouble recognizing social cues. So if you're more familiar with maybe autism, you know, some of these things might seem similar, right? Where there's trouble with executive functioning skills, some social cues, things like that. People might have trouble with initiation, so getting started on tasks. That can be a challenge. And as the individual in the video said, relationships might change too. I wanted to just briefly touch on lack of awareness because it can be a really tricky thing to try to address, especially in like a rehab setting. If somebody's not maybe aware that changes have happened, or it can be really hard if it's a family member or a loved one, because you're like, I can see, you know, that something's different, but you can't really convince somebody of that. So self-awareness deficits in brain injury have been reported as occurring up to 97% of people with TBI. I'm so sorry, that is a very outdated study. I'll have to look for something more recent, but suffice to say, it happens often. And why? So self-awareness requires, you know, complex thinking skills that are often weakened after a brain injury. So I wanted to just take a moment here, now that we've learned about, right, like there's actually physical changes in your brain that cause then these other types of changes, whether they're physical or emotional or behavioral. And so people with brain injuries are not lazy or unmotivated or being difficult. There's something going on, some change or, yeah, alteration, I guess, in functioning. And we have to be mindful of that. So I have a poll question for you. Again, great time to take a quick stretch break, get some water, check in with your body, see how you're feeling. I know I always hunch down, so scrunch your shoulders up by your ear. Okay. All right. And when you're ready, I'll ask you about executive functioning. So what is executive functioning? Is it a set of complex thinking skills that help us achieve goals? Is it B, neurologically based skills involving mental control and self-regulation? Is it C, helping us get things done? Or is it D, all of the above? I'll let you weigh in. But it's going to be D. It's going to be all of those things. Executive functioning is really, it's a big deal. All right, so I gave you a little taste of this before. Special populations, certain groups of people that are affected by brain injury, you know, perhaps more than others. So I'll go through this. If you have questions, if you want to see the studies, reach out to us. I'll put a contact slide at the end. There's constantly new research coming out. So I wanted to start with kids. Kids are more likely in some instances to have a traumatic brain injury, usually because of falls. I know that watching my little brother grow up, learning to walk. He was falling all the time. His big head, we're Nesbits. But he also would fall down the stairs a lot, and kids just, their brains aren't developed, they're learning. But they're also might have higher rates of TBI because of car crashes. And then, like I said, because of child abuse. Children's skulls are thinner than adults, making them more vulnerable to injury. One thing that can happen is that if a kid has a brain injury, you might not notice the effects right away. And we call that growing into brain injury. So imagine your child, or a child, is in a car crash when they're 6 or 7. Well, when you're 6 or 7, you don't really have to be using your executive functioning skills or some of the skills that could be changed as a result of a brain injury. And so, they're fine, they'll heal well. But then as a child gets into like middle school, where they're having to remember 3 locker combinations, they have 5 different binders for every class. You're not with the same group of people every day. It's these new faces. Maybe suddenly, the child has trouble functioning. So sometimes people see the effects of brain injury come out then, or there's behavioral problems coming up at that point. And if your child had an injury at 6 and they're 13 now, you don't always immediately think, oh my gosh, it must be the brain injury, right? But that is something that can happen. And so we'd have to think about, how do you support a kid with a brain injury in school, and how is that different from other types of disabilities? One thing to know too is that childhood TBI actually doubles the likelihood of a psychiatric disorder by early adulthood. So kids are having brain injuries. We know sort of the changes it might cause in your brain, whether that's physically or emotionally. And then children are developing those psychiatric disorders. I think the format of these slides are going to be like, I'll tell you a little bit about the population and then we'll look at a study. So for children, compared to kids that didn't have a TBI, by age 10 to 13, those that were hospitalized with a mild TBI before age 6 they found them more hyperactive and inattentive, according to the parent and teacher. They were more likely to be diagnosed with ADHD, conduct disorder, oppositional defiant disorder. They were more likely to have substance use problems, and again, more likely to demonstrate mood disorders. So I share this just to get you thinking about how we can support kids after they have a brain injury, not just weeks or months, but moving forward as well. They might need our support a little more. And as I mentioned earlier, older adults are at higher risk of sustaining brain injuries. As we age, we have increased risk of falls for a lot of reasons, but we might have lower body weakness, or foot problems or pain. I know diabetes runs in my family, and my grandfather had his toe amputated because of that. And so he had trouble walking, making him more likely to fall. You might have vision problems. You might be on some different medications that just make you more likely to fall. So blood pressure medications, blood thinners, or sedatives. Neuroplasticity is your brain's ability to heal itself and to generate new brain cells. And we know, at least right now, we think that decreases with age. Another thing that makes older adults more likely to have brain injuries is that our brain atrophies over time, so it shrinks, actually. And that increases the distance between the brain and the skull, so there's more space. And that makes your vessels more prone to that shearing that we watched in that video, that tearing apart. And so that might mean that that's how people are getting some injuries or making them worse potentially. For service members, so a lot of research and a lot of our knowledge, I would say, in brain injury comes from the military, or at least some of it, after the wars in Iraq and Afghanistan. But some surprising things that I learned when I was actually learning from Stacia Edmonston is that TBIs are actually mostly happening outside of combat in the military. So I'm getting ahead of myself, but in general, TBIs are more common among military personnel than the general population, right? So just your average Joe and your enlisted Joe, the person in the military is more likely to have a TBI for a couple of reasons. So the highest concentration of service members, so the amount of people in the military, are usually between ages 18 and 44, which is one of the age groups that is more likely to have TBIs. We also see, I don't know if you know folks that are in the military, my wife is, and I've certainly seen this, is that drinking is common, especially if you're in a more rural area. There's greater consumption of alcohol by military personnel. And then there's also just a greater risk for other injuries associated with non-combat military duties. So you have basic training where you're going through a whole lot. You might be just doing other jobs that are more physical and more vulnerable to injury. So here's what I was saying that I found surprising is that actually 80% of TBIs in the military since September 11th were non-combat related. So 20% are happening in combat, which is still a lot, right? Still too many. But TBI was then considered like the signature wound of Iraq and Afghanistan wars because of the brain injuries that were coming out of blast injuries. So we'll get to the study on this. So there was a study in 2017 of a small amount of 167 veterans. And when they had TBIs, they were more likely to have a history of depression, substance use disorders, more depressive and PTSD symptoms, poor executive functioning. Excuse my slide. I listed a couple of things twice, right? But they were having a lot of trouble after their injuries. And there is a lot of support for the military for people with TBIs. There are some resources specific to those folks. So as I mentioned just ever so briefly at the beginning, people who are homeless are more likely to have TBIs. In a study done in Canada in 2014 and 2004, out of about 900 people receiving shelter or meal services that were homeless, half of those people had a history of a TBI. There was a later, smaller study at a men's shelter, and about 45% of those people screened positive for a history of a TBI. Of those people, almost a third, I don't know if my math's right on that, almost 73% of people had their first, or three-quarters, I'm sorry, their first TBI before adulthood. And a lot of people had their TBI prior to their homelessness. So I don't know all the reasons why that's the case, but I could guess. If you're having trouble with executive functioning, with managing your bills. Okay, so if people are having trouble with executive functioning skills, which, to be honest, is a lot of budgeting and bill payment and things like that, that might become an issue after a brain injury. So I think a couple of things makes